Hello guys, hi everyone, and this is Build Health with Ezinne. My name is Ezinne Aso, and I am the healthcare girl. I never really started off my career to do anything in healthcare. Well, I started my degree in pharmacy, and then I realized that this was not my path because finding the cure to HIV/AIDS, which was one of the reasons why I chose to study pharmacy, took a long path. And so let me tell you a little bit about my journey. I had an accident when I was very young, and it kind of redefined my interest in pursuing a degree in pharmacy. And so I was like, pharmacy or not. My dad wanted me to study nursing. I was like, nah, I want to be a pharmacist because, drugs was one of the things that saved my life during that accident, was because the pharmacy was kind enough to give us medicines for free at the time because my parents were not around. And so it kind of helped save my life, and I wanted to study a degree. In fact, after the time, I was always going back to that pharmacy, going to anytime anybody is sick in the environment, in the compound, I said, please let me know. I really loved that pharmacy. The pharmacy is actually in Lagos, Nigeria. And so I studied really hard, and I got into the University of Ibadan to study pharmacy. And sort of like, that was really, really, I was excited because it was very competitive to get into the degree. But I realized, very soon that this was not my path. I was not excited about the smell of chemicals and the lab, and I realized that it takes 20 years to actually find the cure to a drug. Unlike now, well, AI has done a lot, but I kind of lost interest. But until I met a patient, her name is Ashame. Ashame kind of shattered my ambitions to go into finance. At the time, I was already pivoting into a career in finance, so a lot of my friends were from economics, finance, and University of Ibadan, and they were always talking about getting an internship with Goldman Sachs and some of this. I was already applying, studying hard, some of the finance concept. And then I met this patient. There was a nationwide strike across hospitals, government hospitals in Nigeria, and healthcare students were posted as part of our externship to go and support and check on patients. And I walked into this ward, I can remember the ward in the renal unit of the University of Ibadan, and I met this patient that kind of like shattered my ambitions and made me realize I need to build for health. Her name is Ashame, and Ashame was crying, and she asked me a question. When I asked her what's going on, and she was like, what can a 20-year-old do without both legs? I think that question kind of shook me a little bit because at the time I was also 20 years, and it kind of made me really think hard about the millions of people who might be in that situation too. And so I decided to pivot my life. I remember crying that day as I walked out of the ward because she already lost one leg due to diabetic neuropathy, and the second leg was scheduled for surgery. And it's really, really helped me think about what I want to do, and that's why I'm building for health today. And that is why I decided to go back to school to study at Johns Hopkins University about this business. I've also practiced, I've worked with different organizations